Hi, this is Dr. José Barrera from San Antonio, Texas. It's an honor to present to you our upcoming paper on comparing dorsal preservation rhinoplasty techniques. In this paper, I looked at subdorsal septal strip methods, specifically the high strip technique, the Z-flap, as well as the mid-strip technique, the modified subdorsal strip method. The key points of this paper were to look whether there was a difference in septal strip methods after preservation rhinoplasty as measured by patient-related outcome measures. And overall, we found no difference amongst dorsal preservation rhinoplasty patients undergoing the Z-flap technique versus the MSSF technique at 1 month, 3 months, 6 months, and 12 months postoperatively. We felt that the subdorsal strip method was an area that was not previously published on when looking at patient-related outcome measures. Therefore, we chose to compare subdorsal strip excisions in patients undergoing dorsal preservation rhinoplasty using patient-related outcome measures, specifically the nose score, the sinonasal outcomes test 22, the Schna score, and the Epworth Sleepiness Scale. We matched 71 patients, which met inclusion at 12 months, with an average age of 23 years old. Overall, there was a predominance of female patients, 62 to 9 male patients, and there was a matched cohort of 36 patients undergoing the Z-flap technique and 35 patients undergoing the MSSM technique. Now, preservation rhinoplasty surgery is an older surgery first pioneered by Dr. Goodale in 1899. At this time, he addressed a dorsal hump by excising subdorsal cartilage and performing lateral osteotomies with disarticulation of the nasal frontal junction, allowing descent of the dorsum and the end hump elimination. Dr. Goodale's technique was applied in modern dorsal preservation rhinoplasty, utilizing both modified subdorsal strip methods, such as the MSSM, and the Z-flap strip techniques. And although a high strip technique has been popularized by Lothrop in 1914, there have been many authors, including Dr. Cottle, Dr. Saban, Dr. Neves, Dr. Most, amongst others, that have described their various septal strip techniques. However, the literature has a poicity in comparing septal strip techniques and patients' aesthetic and functional outcomes. Therefore, we elected to compare septal strip methods in patients undergoing subdorsal preservation rhinoplasty as measured by the nose, SNOT 22, the Epworth Sleepiness Scale, and the Schna scores. Now, the reason why we decided to look at septal strip techniques was because we standardized the osteotomy in this patient cohort, where every patient received a letdown osteotomy utilizing piezoelectric ultrasonic rhinoplasty surgery. Septal incisions can be performed in various ways. With the MSSM technique first described by Dr. Most and the modified Z-flap technique first described by Dr. Kovacevic. And although I modified these techniques in my own practice, they both involve vertical releasing incisions through the dorsal septum in order to maximize the inflection point at the maximum dorsal convexity. A letdown dorsal hump reduction was performed utilizing piezoelectric techniques, and a wedge of septal cartilage was performed in all the patients in order to making sure that there were no blocking points and to alleviate buckling at the nasal pyramid. A narrated video of this technique has been previously published in Facial Plastic Surgery and Aesthetic Medicine Journal. under authors Lujan and Barrera, as well as several other papers utilizing these techniques by other authors in the literature. We decided to really focus on septal strip techniques in order to have a comparative, ordinal, and consecutive cohort of patients that were evaluated at 1 month, 3 months, 6 months, and 12 months. Functional outcomes were evaluated using the nose score and the SNOT-22 scores, as well as the SNOT score, while the SNOT score also provided us additional data for the cosmetic outcomes as reported by patients. Sleepiness was also measured, since nasal surgery is often recommended in sleepy and obstructive sleep apnea patients, but the goal of the paper was not to describe whether these techniques improved obstructive sleep apnea. In this consecutive series of dorsal preservation rhinoplasty patients, those treated with a high-strip Z-flap approach compared to those treated with an MSSM approach showed similar results as measured by the nose score, SNOT-22, Epworth Sleepiness Scale, and the SNOT score. There was improvement in all these outcome measures, with an overall delta drop greatest in the cosmetic score of the schnoz as compared to the functional composite scores. We compared our results with other reports in the literature, which had similar findings, but in a smaller cohort of dorsal preservation rhinoplasty patients. Most and colleagues showed no significant increase in nose or schnoz scores after cosmetic rhinoplasty using preservation rhinoplasty techniques. Other studies have described different cartilage manipulation techniques, but none have compared two different techniques and their related outcome measures. These findings that we report are consistent with and extend those of prior reports. The implication of the study really shows that subdorsal strip methods are effective in improving functional and aesthetic outcomes. Since all patients received a let-down bony technique, there was no comparison between push-down and let-down osseous techniques. However, previous papers have compared push-down and let-down technique and postulated that impacting the nasal bones with a push-down technique could affect the piriform aperture and lead to airway obstruction. It would be useful to evaluate surface techniques as well as composite reduction of the dorsum using a similar methodology as we present here in future studies. So these data must be interpreted in the context of the study design. We note that the patient's overall nasal obstruction burden is improved using different outcome measures, specifically nose, SNOT-22, and schnoz scores. The average 12-month follow-up is widely held as the long-term follow-up for rhinoplasty patients, but we also agree that it is not the endpoint. Given the improvement in the patient-related outcome measures and somewhat difficulty in obtaining long-term follow-up, an ordinal cohort for comparison of 71 patients, 35 MSSM patients, and 36 Z-flap patients was sufficient to compare in this group. Complications were limited to residual hump in 2 patients, 2.8%, with 1 patient requiring revision, axis deviation in 1 patient, or 1.4%, which did not completely resolve with the technique and was pre-existing, and tip deviation in 1.4% of patients, and a patient with pre-existing tip deviation. 1 patient did have a surface burn from the piezoelectric saw, which improved after conservative IPL and CO2 laser resurfacing. However, this patient did not meet the inclusion criteria because there was no long-term follow-up at 12 months, but for completeness sake, it is described in this podcast. Care must be taken to avoid skin injury with a piezoelectric system and to allow for ample cooling of the saw when used. Larger investigations across multiple institutions and varied surgical practices would yield more robust results. Confounding factors such as seasonal allergies, inferior turbinate hypertrophy, and use of nasal steroids were not controlled for in this analysis. But patients presenting with concomitant septal deviations and nasal valve incompetence were evaluated by nasal endoscopy and modified Cottle maneuver and were treated as part of their rhinoplasty surgery in this study. Although the number of patients is limited, outcomes at 12 months postoperatively in this cohort of patients were assessed, and reported improvements were maintained long-term as healing continued to progress up to the 12-month point. A total of 36-month follow-up was achieved in this cohort of patients with report of patient-related outcomes at 12 months. In conclusion, patient-related outcome measures related to aesthetic and functional results after dorsal preservation rhinoplasty are a critical next step in reporting outcomes. And specifically in this study, amongst patients undergoing preservation rhinoplasty, those having the MSSM compared to Z-flaps of dorsal septal cartilage technique demonstrated improvement in nose score, SNOT-22, Epworth Sleepiness Scale, and Schnauz score. I would be happy to discuss this paper with you further and can answer any questions if you would like to reach out to me on Instagram at my handle at Dr. José Barrera or Facebook at Dr. José Barrera, or you can contact me through my website, drjosebarrera.com, or feel free to call me at 210-468-5426. I'm honored to present this paper to the Facial Plastic Surgery and Aesthetic Medicine Journal. I look forward to hearing from you. Thank you very much.